The fact is, I think oncology brings to the table a complicated, interesting, constantly changing dynamic, and I would dare anyone to tell me a field of medicine where you can do more to impact a patient's life. When I graduated my fellowship, there was one drug for colorectal cancer, and we gave it as a push, we gave it as an infusion, but it was one drug. We now have easily 10 drugs for colorectal cancer. So the number of things you can do, the number of iterations that you can make is so much more. And patients are living longer. I think that people forget that while we talk about a cure for cancer, and that's important, what we're doing is we're seeing a prolongation of median survival. So average survival times are going longer and longer. It's not unusual for me to have a patient with lung cancer who is alive for several years. When I graduated, that was not the case. We were still having the debate, should we even treat stage 4 lung cancer? Now, no one ever asked that question. We have so many more options to give. Immunotherapy is a new darling, and it's, exciting, and patients tolerate it well, but it doesn't work for everyone. And so you still have to go back to, well, if that doesn't work, what else can I do? How can I play this so that my patient gets best quality of life, longest duration of life, increase the number of cures? That's always in your agenda as you assess a patient. That's what I enjoy about oncology, that it is always changing, that I'm having to learn something new, that we can push the envelope, and that for me is exciting. I think if I had to do the same thing over and over again, I would just wilt. When I was in my second year of residency, I was thinking of oncology versus cardiology. And I made that decision as a resident when I was asking, the millionth patient about chest pain one night. And I thought, how would it be 20 years from now? I'm asking chest pain. If you look at cancer, in my opinion, it's not one disease. And there are a whole host of genomic and genetic alterations that take place for each person's cancer to get to the state of uncontrolled growth. And we're now beginning to scratch the surface of that with sending an individual patient's tissue for testing to try and figure out how do we best approach that tumor. And I see that area as being the area where there's going to be phenomenal growth, and we're going to make more intelligent choices about an individual patient's treatment plan.